My name is David Raizen. I'm a associate professor of neurology here at Perelman School of Medicine at the University of Pennsylvania. My lab is interested in the molecular mechanisms that regulate sleep behavior. In the past 10, 15 years, it's become increasingly appreciated that all animals sleep, not just humans and not just mammals, but also the roundworm, c. elegans, is what we call sick sleep. And this is the kind of sleep that we as humans get when we're sick with an infection, for example, the common flu. So we did an experiment to ask, what is the consequence of sleeping in response to sickness? Is it important? By causing it to be sick, and we asked what happens when we do that. The animal falls asleep, but we asked what happens when you do that in an animal that lacks this one neuron ALA. What happens to its survival? And what we found is, in fact, if we take out this ALA neuron, the animal's survival is impacted, it's impaired. So the animal lives shorter after the stressor when it lacks the ability to sleep than when the ability to sleep is intact. And I should say here that this work was all done in collaboration with a laboratory in California, that of Cheryl Van Buskirk. So what we found when we looked at the effect of age on this sick sleep is that sick sleep is reduced with age. The animal goes to sleep in response to this sickness, and part of this mechanism involves activation of a single neuron, as I mentioned, called ALA, by a cytokine or a molecule that communicates between cells called epidermal growth factor. And then we've established the mechanism downstream of epidermal growth factor. So what we were able to ask with this model is whether if you simply increase the level of epidermal growth factor, you should activate all downstream events, including putting the animals to sleep, without exposure to the sickness. And in fact, we found that the animals fell asleep perfectly normally. There was no defect, there was no change as a response to age. 1-day-old, 3-day-old, 5-year-old animals all fell asleep equally well in response to epidermal growth factor. So what that experiment told us is that the age modulation of this sick sleep process is upstream of epidermal growth factor. In other words, it's somehow in the animal's ability to detect this stressful event, this sickness, and the communication, the release of epidermal growth factor.